Hi, welcome. Come in, take a seat. My name is Christine and I'm going to be your nurse for today. I see you're requesting more information on your condition, chronic obstructive pulmonary disorder. So let's jump right in. Chronic obstructive pulmonary disorder is a respiratory disease that causes air to struggle getting into your lungs, making it harder for you to breathe. Chronic obstructive pulmonary disorders include emphysema and chronic bronchitis, or any combination of the two. In our lungs, we have a complex system that keeps us breathing. We can think of it as an upside-down tree because of its many branches. It all starts with air moving in through your mouth or nose to your trachea. And then from your trachea, it branches off to your bronchi and then into smaller branches known as bronchioles. Then the bronchioles lead to alveoli, which are small sacs. And this is where your body trades fresh oxygen in exchange for carbon dioxide. Now that we know some anatomy, we can get into what chronic bronchitis and emphysema really mean. Chronic obstructive pulmonary disorder is a respiratory disease that causes air to struggle getting into your lungs, which makes it harder for you to breathe. Chronic obstructive pulmonary disorders include emphysema and chronic bronchitis, or a combination of the two. Emphysema affects the air sacs or alveoli of your lungs, while chronic bronchitis affects your bronchial tubes. It makes the bronchial tubes get inflamed and narrow and increase in mucus and phlegm production. Symptoms of COPD include frequent coughing, wheezing, chest tightness, lack of energy, excess phlegm production, and shortness of breath. The number one cause of COPD is smoking, but you can also develop COPD if you are exposed to chemicals and fumes in your workplace. Long-term exposure to air pollutants and dust can also cause COPD. COPD and lower respiratory diseases were the third leading cause of death in the United States in 2014, and almost 15.7 million Americans have reported that they have been diagnosed with COPD. If your doctor suspects that you have COPD, they will usually run a few tests. These include blood work that measures the level of oxygen in your blood, chest x-rays, and also a spirometry test. The spirometry test measures how much air you can force out of your lungs in 1 second. This is known as FEV1. You'll breathe out into a machine called the spirometer, and it'll give us a reading, and we'll use your score to compare it to a normal FEV1. But what is a normal FEV1? Well, every individual has a different normal, because a normal FEV1 is calculated by using factors such as your age, gender, and height. So basically, we'll compare your spirometry reading to that of a person with normal and healthy lungs. Your doctor will then calculate the percentage of difference between the two numbers, and you'll get a score that will then put you in what stage of COPD you are in. This staging system is known as the GOLD scale, and it lets us know how severe your condition is. GOLD Class 1 is rated as mild, and that is an FEV1 of over 80%. GOLD Class 2 is moderate and is an FEV1 between 50 and 80%. GOLD Class 3 is classified as severe and is an FEV1 between 30 and 50%. And lastly, very severe is GOLD Class 4, which is an FEV1 below 30%. You may need to repeat the spirometry test about once a year so your doctor can track your disease progression. There is no cure for COPD, but there are some things that we can do to help treat it and relieve your symptoms. This includes giving you oxygen or medications to help you breathe a little bit better. The medications used to treat COPD will help open up your lungs and make it easier for you to breathe. Usually this is done through the use of inhalers or nebulizer treatments. Your doctor may also prescribe steroids to help decrease the inflammation in your lungs. If left untreated, your COPD could get worse. So please take your medications exactly as prescribed. And also, it is important to get your yearly flu shot and also get your pneumonia shot because you are more at risk for respiratory diseases. Try your best to avoid secondhand smoke, air pollutants, fumes, chemicals, and dust whenever possible. And also, if you smoke, quit smoking. According to the American Lung Association, about 85 to 90% of all COPD cases are caused by smoking. You see, when a cigarette burns, it creates a lot of toxins which are harmful to our lungs. They decrease our lungs' defenses, narrow our airway passages, cause swelling in our air tubes, and destroy our air sacs, all of which contribute to COPD. It is recommended that if you smoke, you stop smoking. There are many resources to help you to quit, and there are many reasons to quit besides your COPD. As soon as you quit, you'll reduce your risk of heart disease, reduce the risk of stroke, reduce the risk of getting throat, mouth, or lung cancer, or esophageal cancer, and it will also benefit your wallet and your friends and family. A study was conducted in 2015 that wanted to find the relationship between smoking duration and respiratory symptoms in COPD. They gathered a group of people and asked them 3 questions. The first question was, how often do you cough up mucus or phlegm? The next one was, during the past 30 days, how often did you feel short of breath? And the last question was, thinking about your physical activity during the last 12 months, do you agree slightly or strongly or disagree slightly or strongly with the following statement? I do less now than I used to because of my breathing problems. They also asked participants if they were current or former smokers, and if they had quit smoking, how long ago had they quit? The results showed that those that had quit smoking for more than 10 years, in contrast with those that are current smokers, had a much lower prevalence of COPD and respiratory symptoms. The results were consistent with the fact that the COPD prevention strategy is to quit smoking to improve respiratory function and also prevent decline in lung function. In addition, it showed that the health benefits of smoking cessation with regard to the rate of decline in the FEV1 and mortality appeared to be the most significant for those who quit before 40 to 50 years of age. Here are some more things that you can do to help manage your COPD at home. In addition to taking your medications and quitting smoking, you'll also want to drink plenty of water. Drinking plenty of water will help to thin the mucus that's in your airway and help you to cough it up. This means that you must drink at least 6 to 8 cups daily unless told otherwise by your doctor. In addition, you'll also want to limit your caffeine intake because when caffeine is combined with respiratory medications, it may give you a really fast heartbeat. You also want to make sure that you take care of your emotional health. For people living with COPD, the physical challenges of managing the disease can sometimes affect your mood and your health. Most patients with COPD experience sadness, fear, and worry, and this is common for people with chronic and serious illnesses such as COPD. However, if these symptoms don't go away after a few weeks and they're affecting your daily life, you may have anxiety or depression. So let's learn to recognize symptoms of anxiety and depression. Anxiety is a feeling of constant worry, and you tend to anticipate the worst thing possible. Anxiety can also make it harder for you to breathe or make your breathing faster. Depression is a feeling of deep sadness that lasts for more than a couple of weeks. You may notice an increase in crying, and you may be more tired than usual. You also may not feel like doing activities that used to make you happy. If you ever feel like this, please reach out to somebody for help. Your doctor may refer you to a mental health professional that will help you find coping strategies and offer suggestions to help you feel better emotionally. You also want to eat small, frequent meals. You may be too tired to eat a big meal in one sitting, and also a very full stomach can make it harder for your lungs to expand properly. You may want to eat a bigger meal in the morning when you have more energy, or another strategy is to include several snacks throughout the day. Make sure that whatever you are eating has a nutritional content to it, so your body can get all the nutrients that it needs. You'll also want to maintain a healthy weight, or lose weight if you are overweight, since being obese can make it harder for you to breathe. Engaging in physical activity is also important for managing your COPD. Exercising is important to every lifestyle, but especially those to COPD. When you exercise, you may feel short of breath and even become worried that it is not safe. However, moderate exercise has many benefits for you. It can improve your circulation and allow more oxygen to reach your heart and body tissues. It can improve your energy levels and reduce anxiety, stress, and depressive symptoms. It also improves sleep and self-esteem. And best of all, it can actually improve your symptoms of shortness of breath because it strengthens your respiratory muscles and makes it easier for you to breathe. There was a study done in 2017 that wanted to examine the factors that encourage and limit participation in physical activity in patients with COPD. In this study, they asked 26 patients about the obstacles they faced when engaging in physical activity, and they also asked them what made it easier for them to be active. Patients stated that common barriers included physical limitations, such as feeling breathless upon exercising, or having limited mobility. The weather conditions also affected their ability to exercise and their lack of energy. They also described factors such as psychological distress like embarrassment, fear, frustration, disappointment, anxiety, and lack of motivation. Other barriers dealt with negative attitudes, thinking that it was too late for them, or thinking that their condition will not improve, or that it will not delay progression of the disease. Attitudes such as thinking that they are too old, or that feelings that exercise is not important were also reported. There were also social barriers, such as a lack of support from friends and family, or having overprotective caregivers that did not allow them to engage in physical activity. Positive enablers reported were appropriate social support, feeling the excitement of meeting new people, having the obligation to walk their dog, having a positive attitude about physical activity, positive attitudes about limiting disease progression, having the habit of already exercising, and feeling the sense of satisfaction of meeting a new goal. So you can throw your hair up into a bun and get ready to exercise. Focus on your breathing. Breathe in and out for at least 30 seconds. You can try some stretches, aerobic exercises such as walking, biking, and swimming. And you can also do resistance training for your muscles by using weights. You can ask some friends to join you for moral support, or even join a pulmonary rehabilitation group if it is available in your area. This helps to meet more people with COPD who are also trying to engage in a healthy lifestyle. Before you go, I want you to remember to seek assistance by going to your nearest emergency room if you start turning blue, especially in the areas around your mouth or around your fingernails, if you have increased trouble in catching your breath or can't speak full sentences, if you start feeling confused, or if you feel worse in any way. This may be an acute worsening of symptoms called an exacerbation and needs emergency treatment right away. So thanks for coming in. I hope you learned a lot, and if you have any questions, please let me know. Otherwise, we'll see each other very soon. Bye!